So, welcome. My name is Kelly Bruno. I'm a pain medicine physician. And today I just want to talk a little bit about lifestyle medicine and really what that means. It's kind of a new field of medicine and one that I'm starting to get more familiar with as I treat patients as a pain medicine physician. And the reason that I think it's so important and really warrants conversation is because historically, as physicians, we have treated most chronic diseases, whether it's high blood pressure, diabetes, chronic pain, as the disease. And while treating the symptoms of a disease is really important, I think getting to the root cause of the disease is really even more important because that's what's going to have the long-term benefit for our patients and for the general public. And so going forward, I think it's really just such an important component to any treatment plan, and one that really patients can do on their own, if with the right guidance. So, what exactly is lifestyle medicine? What does it mean? And why does it matter, especially for someone who, is an athlete and feels like you're doing everything right already. The reason that I even bring it up, and it's something that I have been so focused on, is because, right, so lifestyle medicine incorporates looking at your diet, your exercise, your mindset, as well as sleep, and a couple other factors like relationships, kind of your emotional connection to the world. And the reason that that's so important is because it kind of lays the foundation for your health, right? And chronic disease, one of the things that, say, high blood pressure, diabetes, and chronic pain all have in common is this idea that there is some kind of chronic inflammation, this inflammatory process that is going on that's causing problems in your blood vessels, problems with your insulin response in the case of diabetes, and then in chronic pain, there's many times some kind of inflammatory process, whether it's in the spine or in the muscles, that's really creating this experience of pain. And what we continue to learn, and there's a lot of research on, is this idea that the body responds to its environment. And again, that's going to be your diet, your exercise, sleep, mindset, all these things that your body is exposed to. And that creates the conditions for these diseases to be created. And so by starting to address a lot of these processes that are occurring, that are allowing your body to respond in this way that is unproductive and is creating disease for you, the goal with lifestyle medicine is start to identify where those issues are and then correct and make changes so that you foster an environment where your body can flourish and succeed and really do well, and you can recover, and you are healthy and you are able to live without this disease state. And so what I have started to do, and what I found incredibly important within pain medicine, is starting to identify where those issues take place, right? Is it your diet? Is your exercise? What part of your lifestyle is contributing to the problems that you have, the disease states that you have? And again, my focus is on chronic pain because that's what I trained in. My background is in anesthesiology, and then a degree in pain medicine, or a fellowship training in pain medicine and research in pain medicine, since that's really what I was interested in. And now, being an athlete myself, I was an athlete for many, many years and continue to see myself as an athlete. I really want to get the message out to other athletes, other patients who are struggling with chronic pain, and try to identify ways that don't require medication, don't require injections, things that, again, I am trained in and I prescribe all the time for my patients, but I find that they are only temporary. They do provide relief. Many of my patients do very well, but the long-term plan needs to involve more than just those treatments. There needs to be kind of an underlying or addressing that underlying issue that's really contributing to that pain state or that pain experience. And that comes in the form of improving diet, improving or making changes to an exercise routine, or incorporating an exercise routine if you don't have one, and then focusing on mindset and the idea of creating an emotional and mental state where you can process pain and either recover from it or really just kind of hold it and release it. And then, of course, sleep is really important, as well as relationships, kind of emotional, that emotional component that contributes to pain and chronic disease. And so that's, like, again, that was just kind of a brief overview of what lifestyle medicine is. It's pretty self-explanatory. The name itself defines really what it is. It's being able to address lifestyle changes in a very constructive and in a way that promotes health by identifying really a lot of the issues that are underlying and contributing to disease states. And so I hope that was helpful. Again, just a brief overview of lifestyle medicine, and what I hope to do in future videos and future blog posts is to provide a framework to start to look at what areas to improve in. And especially for fellow athletes, my goal is to really help you identify where you can make improvements, because what I've seen, and from both personal experience and from managing pain patients, is that what you do now, right, what you do when you're young or at the age you're at, is going to contribute to your experience in the future. So you can get away with a lot when you're 20 years old, but in your 30s and 40s, a lot of the trauma that you put on your body, a lot of the things that you did, say the 100-milers I used to run when I was in my 20s, they start to catch up with you, and those injuries that you kind of put off because you were fine, they start to catch up with you. And so making choices today that will really promote your health in the long term. So that's my goal. I look forward to more videos and more chats and more posts about how lifestyle medicine can help you. And if you have any questions, feel free to reach out, kellybrunomd.com, or through my Instagram, which is just kellybrunomd. I look forward to hearing from you, and I look forward to future posts.